So, a lot of you may have heard the term sepsis, especially if you've been to the hospital. And sepsis is basically a term that we use to describe a system wide or body wide infection. Now, if you come to the hospital, we look for specific indicators that might tell us that you might be septic or that you might have this system wide infection. And things that we look for are an elevated heart rate or tachycardia, an elevated respiratory rate or how fast you're breathing, elevated temperature. Anything over 100.4 is considered a fever. Uh, Even a low blood pressure. Now, to us, a low blood pressure is slightly different than what you would consider a low blood pressure. So anything with a top number lower than like 100 would be considered a low blood pressure. Even if you tell me that you normally run a low blood pressure, we would still consider something lower than 100 a low blood pressure. So if you come in and you tell me, I've been feeling poorly for several days, and I take your vital signs and you're running a fever of 102.5 and your heart rate's like 115 and your normal respiratory rate is between 12 and 20 and you're breathing like 26, and your blood pressure is like 88 over 50, these are all big indicators that you might have a system-wide infection. So the question then becomes, okay, where's the infection at? Like, exactly where is it at? So the first three things that we look at are your lungs, your urine, and your blood. Okay, so how do we figure out if it's one of those three? Well, we do a chest x-ray. And the chest x-ray is going to tell us, do you have pneumonia? So if you have pneumonia, that could be where the infection has started. The second thing is, especially in the elderly, do you have a urinary tract infection? Urinary tract infections can get so bad that it develops into something called urosepsis, which is sepsis caused by a urinary tract infection. The other thing that it could be is some kind of blood infection. And we won't know exactly what kind of blood infection without drawing things called blood cultures. Now, the thing about blood cultures is we will draw them, but we don't actually get the results of them for 2 days because they have to grow out. What they do is they take a smear after we add the blood to them, and then they take a smear of them and they let them grow. And then they also fit them with antibiotics to see which one's going to work the best. Now, does that mean that if we suspect that you have a blood infection that we don't treat you for 2 days? No. What it means is we give you something called a broad spectrum antibiotic. Something like vancomycin or Zosyn. Those are considered broad spectrum antibiotics, and we can go ahead and give you those to treat what we think you have. And even if you don't have that particular infection, it's not going to hurt anything for you to get those antibiotics. So we go ahead and treat in anticipation of finding out exactly what you have. The other test that we do is something called a lactic acid. Because what happens is when you get an infection, your little tiny cells in your blood, in your body, will start releasing something called lactic acid. And when we draw this particular test, your normal lactic acid should be less than 2. If it's above that, it tells us that you certainly have an infection somewhere and we need to treat it. So not only do we treat sepsis with antibiotics, But we also treat it with fluids. We give it lots and lots of fluids to help kind of flush it out and to get that lactic acid level down. So what we do is we do like an original lactic acid, the initial, when you show up at the hospital, and then we do repeat lactic acids dependent on what your initial showed. So if your initial lactic acid comes back like 2.4, we give you a bunch of fluids and antibiotics, and then we repeat your lactic acids and to see if it's in fact working. So despite the fact that we may not have exactly a known source or a known treatment, because we don't have the actual cultures back, then we will actually just continue to treat it with the broad spectrum antibiotics, all the fluids, and anything else that you need maintenance wise. If your blood pressure drops and we can't get it up with normal treatment of fluids, we may have to give you something called a vasopressor, which is another medicine that I'm not even going to try to explain to you. But it's used to get your blood pressure up, which happens sometimes. But sepsis is a very, very serious illness. If you were diagnosed with sepsis, it is very, very serious, and we treat it aggressively. So especially in the elderly patients, we try to get them to understand that if you start feeling poorly and you're running a fever and it's been like a couple of days and your fever's not coming down with Tylenol and Motrin, if you can take Motrin, you need to come to the emergency room. Sepsis can be life-threatening. Sepsis can kill you. We see a lot of elderly patients that pass away from sepsis because they wait too long. They don't seek treatment. So if you have a parent that is elderly and you start seeing them being fatigued or very tired all the time suddenly, and they're running fevers and you just can't get them down, they're not eating, they're not drinking, you need to get them to the emergency room, because this is a life-threatening illness and we need to take care of it as quickly as possible. So I hope this helps explain a few things. Sepsis, like I said, sepsis can be caused by a multitude of other things. Abscesses. If you develop abscesses, which is it's basically a pocket of pus underneath the skin. You can get septic from that. If people that are that have ports that they get chemo through, you can get septic in that. If you've recently had surgery, you can get an infection from the incision wound if you're not keeping it clean. There is a multitude of different ways that you can get an infection and it progressed into sepsis. So if you have any concerns where you're exhibiting any of the symptoms that I've described, you need to go to the emergency room. It is better for us to check you out, reassure you that everything's okay, that you just basically have a baseline infection and you're not septic, than it is for you to sit at home, get progressively worse, and worst case scenario, die, when we could treat this. So if you have any questions, let me know, because I would like your input.